I devote most of my time to endodontics, about 65% of my practice. What is most rewarding is when the patients come back with no more pain. When you see at the follow-up, for example, a big lesion that's completely healed, this is really rewarding, honestly. The endodontic anatomy is very amazing, but could be very variable. Of course, if we think at how much is complex, it looks like it is impossible to carry out a proper treatment. But we are doing this treatment for a long time with great success. So the gold standard of endodontic is to properly shape the canal, respecting the original endodontic anatomy, enlarging the apical third, but at the same time without remove too much sound tissue in the coronal third in order to preserve pericervical dentin. Every time we create a ledge perforation, we can reduce the outcome of the treatment. We face often calcified canal. The most tricky part is to find the canal in the coronal third of the root, and to avoid to create ledges while we are bringing the file in the apical part. The rotary file is the tool we use, but behind the rotary file there is the technique. And in my opinion, the technique is still more important than the rotary file. You should create a space that is good to get a deep cleaning and to get a proper obturation. Nowadays, thanks to the rotary files and the heat treatment and evolution in terms of obturation and cleaning as well, it's not so difficult to reach this gold standard. There are specific indications to the use of the bioceramic sealers. For example, when it is not possible to dry completely the canal because of the anatomy, now you can use a sealer that needs moisture to set. So this is a big advantage. When you cannot carry out properly warm vertical compaction because of the anatomy, this sealer is the solution. And so nowadays I'm still using both the warm vertical compaction with ZOE and the bioceramic sealer. It is about 50-50, but probably in the future will be more balanced towards the bioceramic sealer, especially when the cost will reduce. We are all waiting for that, honestly. I'm looking forward to come in Sydney for the FDI Congress next September. I'm excited. Every time I go in a Congress, it's a way to reach your knowledge. If you work in private practice, what is missing is to speak with other colleagues about problems, about how to fix problems. So the dental congresses are a very great opportunity to do that. So you can attend lectures and then you can ask to the speaker and then you can ask to your colleagues. So it is really difficult to come back home with no tips and tricks or some solution that can ease your practice. So that's why I strongly suggest everybody to participate to congresses.